with each of you on this topic of Medicare supplement. And I'm going to switch my screen right here just a little bit. It's always kind of interesting when this technology switches over to where I'm the speaker, it moves all my screens around on me. And so I'm going to slide one across here. There we go. Okay.
Okay, it's looking really good. We can see your PowerPoint.
Fantastic. That's what we want. Melissa, thank you for doing an excellent job of introduction and helping folks to know what are some of the options that are available for them. If you have questions, and indeed, as Melissa stressed, we would like to encourage lots of interaction on this. I don't see this as just a diatribe coming from one side of the equation. I want to encourage you that if you have questions or think you want to get more information, just type in a question sign and send it to Melissa, and we can either unmute you, or if you type out the question, we'll deal with the question. And you don't need to wait until the end of the presentation to ask your question. As we're going through, a question comes to mind, let us know, and we want to help you then to move for that understanding better about Medicare, because it can seem like a complicated process, but my goal today is to help you to see the basics and understand them and find it as an easy way to move forward and an excellent form of healthcare for you for the future. So again, my name is Jim Smith. I'm a church relations representative and a financial services representative from right here in downtown metropolis of Goshen, Indiana. And so I bring you greetings from everybody that you know from Goshen. Well, maybe not everybody, but greetings from Goshen. It's a bright, sunshiny day here for us in Goshen, and I'm looking forward to sharing about the Medicare options that we have available for you. Today in our process, we're going to be looking at, again, understanding Medicare, but we're going to look at some of the resources that are available to you as a person who, maybe it's getting ready for Medicare. You're approaching the eligibility range of turning 65, or you're just about ready to retire. You've been on an employer's insurance. We're going to talk about those resources. We're going to talk about the enrollment process, what that looks like and how it can be done, and how easy it is to make that happen. And then also, we're going to talk about the alphabet. The government has this wonderful wisdom of using the alphabet for everything. And sometimes the alphabet can become confusing for people when they start talking about Medicare Part A, Part B, the plans A, Plan B, Plan F, and so forth. And by the end of this presentation, hopefully you understand it and it seems a lot simpler to you. We're also going to talk about what's not covered. What are things that Medicare doesn't cover? Sometimes that surprises people, but most of the time they're generally very pleased at how much Medicare in fact does cover, but there are some items that Medicare does not cover. And then we're going to talk about what does it mean to fill those gaps. Medicare is a great program and offers a tremendous health program for persons 65 and over typically, but there are some gaps that they have that Medicare supplements can help fill. So we're going to move forward on that process then. Next, we want to take a look at these resources. First of all, a basic understanding about the structure of Medicare is that, in fact, it is a federal health insurance program. And it's a program that's been around since the mid-60s and has been something that Medicare or that Everence has offered to you as long as Medicare has been around. Primarily, the federal health insurance is primarily focused on persons that are age 65 and older. You know, if you're working past age 65, had employer insurance and so forth. But it is also a health insurance program that's designed for persons with disabilities and happen to be in need of some kind of a healthcare need that they would have for the healthcare coverage. So with those aspects, those are primarily the ones that are going to be utilizing the Medicare. Medicare also pays those approved charges that we would have. Primarily, if you go into the hospital, Medicare is set up to help cover those expenses, and we'll see just exactly how that works. It's also designed so that once you're out of the hospital and you're going to the doctor, you have that specialist event that you're going to a therapist, or to need some testing done, how Medicare picks up on those costs can really make a big difference for you as you reach those age of being Medicare eligible. And then also, Medicare pays about 75% of your prescription drug costs that you have. That can be a big factor. And perhaps you've noticed during this time period, beginning sometime around the beginning of October, not only do we have a lot of political commercials on TV, but there are these long, protracted, I'm going to call them infomercials that Medicare companies are putting out there, and you will learn a lot about Medicare in that way. But usually it's a one-sided event. We want to give you a broad overview of those aspects of Medicare. So it's a federal insurance program designed for persons age 65 or persons that have a disability, designed to help pay those charges that are approved, and that's an important word, approved charges, for when you go to the hospital or medical services and pick up on those prescription drug costs. Medicare enrollment. Now, if you happen to be age 65 and already are on the Social Security system, you're automatically going to be enrolled. You're going to get a card in the mail, and it'll look something like the lower left-hand corner down there, where it'll have your name, and then it'll have the Part A and Part B that you have listed on there, and when your effective date is. Typically, that effective date is going to relate to the month of your birthday, of the year, I'm sorry, of the month of your birthday. So for example, if you happen to be, in this case, it's July, is your birthday the 10th, the 15th, whatever it is, your effective date would be 7/1, and it'd be 2017 for next year, if that's when you're turning 65. And it's an automatic process. Also, there's a time where you're going to get a card in the mail, and it's going to be this welcome to Medicare that you may see, and some of you may have already received that in the mail. Sometimes people say, well, you know, I think maybe that came in the mail. And when you're turning 65, you're going to be getting a lot of mail that relates to Medicare. Some of it looks very official and some of it's not, because it's companies that are wanting to sell you their coverage that they would have. And sometimes things get tossed. But no problem, you can go to your local Social Security office and you can get enrolled, or you can go online to Medicare and enroll online. It's a very simple process. There's an initial enrollment period that you want to be aware of. It happens at 6 months total, or I'm sorry, 7 months total actually, for enrollment. You have 3 months before you turn 65. You have the month of your birthday, so there's 4 months. And then you have 3 months following your birthday. So a total of 7-month period in there where you actually have the initial enrollment time. Now, if you're working, you may want to postpone that because you have current coverage through your employer or through your spouse's employer. You can have coverage, and you can postpone that and not receive any penalty or have to pay a higher cost for the premium later on when you do get Medicare. So that's the Medicare enrollment process there. And let's go to the next one here. Now let's talk about those alphabets that we have. The first alphabet is Part A. Well, that makes sense, doesn't it? Part A. And primarily, that focuses on your cost when you go to the hospital. Next, it's going to be, you guessed it, Part B, and that's going to pay for those costs when you are outside the hospital. So if you have a medical event of some kind, you end up in the hospital, your Medicare Part A is going to cover that portion of that. Once you're out of the hospital and you're going to visit your family doctor, going in for those specialists or therapy, physical treatments, maybe some hardware that you would need for medical equipment, your Part B can pick up on some of those costs. And then there's a Part C. And this is referring to the Medicare Advantage program where the government has contracted with some private insurers, where you actually leave Medicare and you go down with this primary carrier of this private insurer company, and it's set up like an HMO, PPO style. And we'll say more about that later on, but Part A, Part B, Part C, and you guessed it, Part D. I usually refer to this as the Part D for the drugs or your medication prescription drugs that you would have, and it covers that plan. And we're going to take a look at each one of these and talk about how they could be a real valuable resource for you. So Melissa, I'm just going to stop here for just a second. And if somebody has a question, I invite you to send a signal to Melissa and we will try to pick up on that. We've talked about some of the things that Medicare covers. We've talked a little bit about the alphabet, and we've talked about the primary focus of Medicare. Has that created any questions, Melissa?
Hi, Jim. No, not yet. Everyone's fairly silent right now. That's a great sign that you're explaining everything really well.
Okay.
But yeah, I'm looking here. No questions, but yeah, feel free to ask your questions.
Okay, well, periodically I will pause like this, and so if a question comes up and it happens to be on some of these earlier slides, hey, we're glad to have you send those questions to us. Okay, next we want to take a little closer look at this Part A for the hospitalization. Something that you should fully realize is that these prices I have on here, I've got a 2017 where it talks about the deductible for hospitalization for Medicare has not been finalized. I was checking this morning again on the web, hoping that perhaps they would have it. I have noted in there in the lighter blue what the deductible for 2016 was, the $1,288. Not sure what it's going to be in 2017, but I'm going to guess it's going to be a little bit higher. And what that basically means for you is that if you're to go in the hospital, Medicare says because you have paid through your taxes over the years for this Medicare coverage, this healthcare coverage you have now, they're going to pick up your medical costs. So let's say you go in the hospital, you check in, you show them your Medicare card and your Medicare supplement card, they make a copy of it, they hand it right back to you. Next then, you're going through the hospitalization process, you get well and they send you home. Medicare then is sent the bill for that hospitalization. They then, of course, for the approved cost, it's not going to be there are some costs, and we'll discuss what those costs are later on that aren't covered, but you're going to go there for almost all the medical procedures that you're going to go through, it's going to be covered. And so they will pay everything for 2016, everything except $1,288. They refer to that as their deductible. Medicare sees that as your expense, not theirs. They may pay $200,000-$300,000 for your medical care there in the hospital, but they'll deduct $1,288 in 2016 from it. Now that deduction, that deductible amount is not yet finalized. It may be the same for next year. They've done that, but more likely it's going to be an increase. And they're talking anywhere from 15, 20, and higher percentage where it would increase. So that would mean then that that would be a portion Medicare would see as your responsibility. That's one of those gaps that we refer to. Then Medicare has more good news for you. If you go into the hospital again as a follow-up procedure or because another event happened in your life that required hospitalization, and it was more than 60 days, you get to pay that $1,288 again in 2016, and whatever amount they determine for 2017 would be your responsibility again. And if you were to have multiple hospitalizations in 1 year and they were more than 60 days apart, you would have that deductible amount that you would need to pay again and again and again. And that's where Medicare supplement insurance can be really valuable for you. Next, then, we want to take a look at the Part B. We've looked at Part A, which is for hospital. Part B now is for these medical services or outpatient services, as they're referred to sometimes. Something you should be aware of, Medicare does not force you to pay or to take Part B. Part A, and I forgot to mention this, Part A is free because the taxes you pay, you don't have to pay a premium for Part A to the government. However, Part B does have a premium. This coming year in 2017, they have raised it from the $121.80 in 2016. In 2017, it's going to be $149 premium, this charged to you as a policyholder for that Part B from Medicare. and that's paid directly into the government there. Most of the time, not always, if you happen to be on Social Security, then you can actually deduct that $149 straight from your Social Security check that you would get, and it's all taken care of. In fact, there are sometimes when I've talked to people, they thought Part B was free, didn't realize it was coming out of their Social Security that they were getting at that time that they had elected to get. However, you can pay it on your own. They'll send you a bill. Usually they do it in quarters, and you'll pay 3 months at a time. And if that's your preference, it can stay that way, or they could deduct from your Social Security. The way Part B works is you go to a medical doctor, to your family doctor, or you have a diagnostic test that you need to go to, and you go in there, and of course these are going to be Medicare approved again. You will have, Medicare will pay 80% of that cost for you. So that 80% is taken care of. They're going to send it to Medicare first, and they'll pay 80%. And then you would be responsible for the remaining 20% of that cost. That's one of those gaps that we refer to in Medicare coverage. First gap was a deductible when you go in the hospital. Another gap here is that 20% remains unpaid. They would see that as your responsibility.
Jim,
Yes.
hey, this is Melissa. You had 2 questions pop up here, and it was about the premium. And someone asks, it's an annual premium, correct? And another person asks, is Part B a monthly fee or once a year? So basically they're wanting to know if it's once a year or is this monthly?
Okay, well, I've got good news for you. The Medicare sets it up so that you pay that premium monthly. They take that $149 out of your Social Security on a monthly basis for those medical costs. And then I have more good news for you. There is a $204 deductible for 2017. This year is $166. In 2017, there's a deductible amount that they would pay. So let's say that, we'll go back to an illustration. Let's say you have a $100 medical bill going to your doctor. Medicare is going to pay 80%. You have already paid $149 for your premium. They've taken out of that. And then there's a $204 deductible for the year there that you would have to pay. And then they start paying after that, beyond, for their 80%. So it's an ongoing cost, and that's some of those gaps that Medicare supplement insurance can really help with on that. So those are good questions on there. So,
but the $149, that's per year.
No, that's premium. That's per month.
Oh, it's per month.
Per month. The premium is a monthly cost. It comes out of your monthly Social Security check, or they'll bill to you separately. The $204 deductible is an annual cost. So that's more good news from the federal government for you when it comes to that. However, it does give you some very, very helpful coverage. Again, Part B is an optional choice, but I certainly always recommend people take both Part A and Part B, because you're going to need that if you want some of that supplemental help down the road for that. Okay, good questions. And thank you, Melissa, for bringing those in. If any others come up, we'll be glad to move on to them. Okay, just a quick review. Part A, hospitalization. Part B, the medical services or outpatient services that you receive. For Medicare Part A, there is no premium cost. It's free because of the taxes you pay. However, for Part B, there's a monthly premium of $149, and then they pay 80%. And for 2017, there will be a $204 deductible for the year that you would have to pay. Okay, so now we'll go to the next portion, and we want to talk about things that Medicare does not cover. And again, Medicare, in fact, will cover many aspects of our coverage that we need, but there are some aspects that, and for the medical cost, that Medicare won't pay. Number one, for most dental care, vision exams, and hearing exams. A lot of people have an image that Medicare covers hearing aids. It does not. It does not cover the exams to have that diagnostic determination. Those are costs that you bear. Medicare hasn't picked those up. Another one is for dentures, glasses, hearing aids, and all the guys out there, if you're thinking about getting cosmetic surgery and you're going to have Medicare cover it, guess what? They don't cover it. So those are some of the key. Now there's some others that I want to also illustrate that are not covered. There's going to be, Medicare has very clearly said that they're not going to cover acupuncture, and there are some healthcare needs outside of the United States. Medicare was designed primarily to meet your needs here within the 50 states that we have, that because you paid it to the federal government, it's for the US citizens primarily, and they didn't design it to be insurance that you could travel around the world with. However, there is some limited capabilities for healthcare coverage outside the United States, but it's not designed for someone who wants to go and have, you know, their kidneys operated on in some other country because they know the doctor or they like the new procedure that's come up. It wasn't designed for that. If you're traveling, there's some incidental needs that would come, it's prepared for that. Now, here's something else that a lot of people have a misconception about Medicare, and that is it's not designed for long-term custodial care. Short-term, immediately after the hospitalization and so forth, yes. But for long-term needs, it's not set up for that. And that sometimes surprises people because they thought that Medicare, long-term care, nursing home care, and so forth were all related to each other, and they are not. So if you have long-term custodial care needs that you'd like to prepare for, Medicare is not your choice. And then here's another one that will sadden a few people: gym memberships. It's not designed to pay for that. If you get some of those silver sneaker programs that are out there, or some like, for example, Everence even has a program where we do some refunding for those type of things. Those things can be out there and can be helpful for that, but it's not through Medicare.
Hey, Jim, we've got
Yes.
some great questions coming up.
Okay.
So here's a question that someone has. Say you're traveling on a vacation. Does Medicare cover emergency care outside the U.S. during travel?
Okay, great question. And the answer is yes. Now, there's going to be some deductibles, and it's going to depend on what kind of plan that you get, if you have a supplement, but primarily it's set up to cover some of those emergency needs, and that's what it's designed for. There's some variations that take place on that, and I'd be glad to review those options that are available to you. If you just give me a call, be glad to highlight those more specifically. But the answer in short is yes. If you're traveling, there's an emergency need, you're going to be able to get some of that emergency care that you need and get you back to the United States. It's not going to be designed for long-term care in that setting. And so that would be an important feature to be aware of. But emergency, yes. Good question.
And here's another question, Jim. Does Medicare cover hospice?
It does cover hospice for some of those cares. Yes, it does. And again, there's going to be some limitations, and that's where some of the supplement programs can be more helpful for you on that. There are some initial coverages for that and pick up on some of those costs. And so it is helpful with the hospice care, yes. However, I think you're going to find that the supplemental, picking up on some of the gaps, again, that Medicare has in its coverage, will be beneficial to take a look at, and that would vary on the choices that one makes at that point. So good. Emergency, yes. Hospice, yes. Again, on very limited basis, you know, not the full extent of those coverages. Any other questions?
Okay, not this time, but there's some great questions coming in. Oh, here's one. How does Part B relate to private supplemental insurance?
How does Part B relate to private supplemental insurance? Part B again, that's a government program where they provide a premium health care, and they're going to cover 80%, again, with the premium and with a deductible. Supplemental insurances will often come in and pick up on those 20% that aren't covered and on the deductibles that they would have. And so that's where the supplements come in, and they supplement or they fill the gap that Medicare would have in some of those programs. So Part B coverage for the government has its limitations. The supplement then can help fill those gaps. Oh, good question.
Okay, I think you can move on now.
Okay, excellent. All right. Next, we want to take a look at the Medicare Part D. Part D, again, for drugs, the prescription drug program that Medicare offers. And it's designed to pay for those outpatient drugs and prescriptions. If for the drugs and medications that you have when you're in the hospital, that's covered under Part A. Once you're out of the hospital and you're in physician's care and you're needing prescription drugs, either on a short-term or a long-term basis, Medicare Part D is a great option. Something as it was with Part B, Part D is optional. You do not have to take Part D. However, I strongly recommend that you take Part D because, let's say, for example, if you decide, well, all I take is an aspirin, I don't need Medicare Part D. You know, I'm a healthy person, all my genetics tell me I'm healthy, and I never had it. And so you wait 2 or 3 years, and then guess what? There's something that arises, you need to have medication, and it's not cheap. And so you decide, well, I'm going to go ahead and get on Part D. You can do that. However, because you could have been on it, say you waited 3 years, you could have been on it 36 months earlier, Medicare says, welcome to Part D. However, you're going to pay a 36-month penalty for not being on it. And then Medicare has some more good news for you. Not only are they going to penalize you, that penalty now becomes part of your premium for the rest of your life, or as long as you have Part D at least. So if you get a penalty and let's say, you know, it's not real expensive, and we'll talk about that a little bit, what those costs are, but it's a penalty that does not disappear. It stays with you. And they have more good news. If they raise the penalty in subsequent years, your penalty goes up as well. So my advice is always get Part D, get it taken care of, get the least expensive plan if you're not taking any or very few medications, and then at least you're into the program. So it pays for those outpatient drug prescription plans. Next, one of the great resources that's offered for Medicare is the Medicare.gov website. If you haven't been there, it's a great place to go and explore, and you're going to see you're going to see some of the images that you see right now on your screen. This is actually a screenshot that I've taken and doctored it up a little bit so you couldn't see the companies that it's showing with these plans, but this is an actual screenshot from there. It's a great resource, very valuable, and you know, that's one of the resources that Everence helps our members with, is to find that plan that can be best for them, and we work with them on that. One of the aspects about Medicare Part D is that the government has contracted with these private insurance companies for each of the zip codes throughout the United States to cover the prescription drug plans. I think, I haven't heard it lately what it is, but it's over 1,500 drug plans that are out there covering all the zip codes and so forth and covering the prescriptions. And they're all private insurance companies, okay? And the government rates them, you'll see there in these little rectangle boxes with a red frame around it, it rates them from a 1 or from 0 to 5 star ratings. And if you have a 3-star or higher drug plan that your company that you're working with, that's a good plan. 2 or 1 or less, you know, might not be as good, or might be a new and hasn't had a chance to be rated, but it's not one that would be one that I would recommend. I always recommend a 3-star or higher plan, and you're going to see these rated on that government website. So that's a nice indication on there for what's a good plan for that coverage. And here we talked about that late enrollment, and that's where the penalty Actually, for 2016, it's around 33 cents a month, okay, that you could have been charged. Well, you say, well, 33 cents isn't much, but take 33 times, say, 3 years, 36. All of a sudden, you're up to 10, 11, $12, someplace in there. And that 10 or $12 stays with you the rest of your life. It can be expensive, and it's not a penalty that you'd have to take. So again, we've looked at Part A, Part B, Part C, and Part D. Part D is one we're looking at here now. And these are, plans that are out there that are meant to help with the Medicare or medical treatment needs that you would have at age 65. Now, you may have noticed in the last few weeks, there's a lot of commercials about Medicare, and primarily it's focusing on this Medicare Part D because there's this open enrollment period every year for Part D where you can take a look at your current coverage that you have with that private insurance company and decide if that's still the best. Sometimes they move, they change, some drugs they don't cover, they stop covering and so forth. So you can make a change so that you can get the best coverage possible at the least out-of-pocket expenses for you. And that happens between October 15th through December 7th. Okay, I see some questions have been coming in, Melissa.
Yeah, there's a question that just came in. It's from Gail, and she asks, she states, my salary and current health benefits will end on June 30th, 2017. I'm not yet on Social Security. However, I turn 68 next month. If I enroll in Part D prior to the end of my current coverage, will I still pay the penalty for not enrolling at age 65?
If you have had, Gail, I believe was your name, Gail, if you've had what's the government terms as credible coverage, you won't be penalized, okay? If it's not a credible coverage plan, and if it's through your employer, most likely it will be a credible coverage, so you won't have to incur any penalty. Same as with the Medicare Part A and B and D, those can all be postponed until you're ready to retire, and those coverages are going to end, and you can then in 2017, when you're ready to retire, you can enroll in the Part D then at that point, and you'll be covered without penalty. And then Part B, the same with Part B and Part A, because you've had credible coverage prior to that time. That's a great question and an important one because there's a lot of people that are working past age 65. And sometimes if you take Part B, well, we'll talk about that some other time. But with those coverages, if you've had them down through your employer, most likely they'd be termed as credible coverage, and you would not have any penalties. Good question. Any other questions there, Melissa?
None at this time, Jim.
Okay. All right. All right, so now we've kind of worked our way through Part A, Part B, and Part D. And now I want to say a little more about our next part, Part C. I skipped over that intentionally. Part C is a little bit, I'm going to call it a different kind of animal because basically, even though it's listed in your Medicare booklet, and here I've got one, maybe you've seen these too. I'll hold this up here, this Medicare and You booklet that you have. It's designed where you actually leave Medicare, the original Medicare plan, and you go to a private insurance company and they provide the medical insurance for you, not Medicare. And some people don't realize that, but if you go with a Medicare Part C or a Medicare Advantage plan, you actually are leaving Medicare, and now you're insured not through the federal government, who you paid the taxes to for the years, but through a private insurance company, and that insurance company receives funding because of your taxes that you pay to them. And so they have this guaranteed income from the government. And so that's one of the reasons they're able to offer the no or low premium because they're getting some funding on that, but they set the rules. And so you're going to find that these Medicare Advantage plans are set up by private companies. They're HMO styles and PPO. And if you've had those, you know what that's like. Basically, you have a network of medical providers that you must subscribe to, or you pay extra cost out of pocket expenses or out of network expenses that we charge to you. And those pocket expenses can go up to $6,700 in 1 year. You know, if you're having a bad year, it could go south pretty quick. In addition to that, you continue to pay the Part B premium. In addition to that, if there is a premium, you pay that to the private insurance company that you would offer that Medicare Advantage plan. So in review again, it's private company, HMO style. A lot of times they're advertised, and you'll see it a lot on TV, no premium or a low premium. And perhaps like myself, when I was a kid, I learned you don't get something for nothing. Well, it's true. They're receiving funding from the government, from taxes that you paid, but then they also give you some pretty strict guidelines and networks that you need to operate under. And that's with the Medicare Advantage program, which is different than a supplement program. And of course, you have the Part B premium to pay.
Okay, Jim.
Yes.
We have a question. It kind of popped up. It has to do back when we were talking about Part D and
Yes.
credible coverage. Brenda was asking, how do you know if your insurance is considered credible? Back there when we were talking about Part D and getting penalties for not signing up.
Yeah, that's a great question, Brenda. Typically, one of the ways you can simply just ask the insurance company that's providing that coverage for you, is this considered credible coverage according to Medicare? That would be one way to do it. Another way would be you could go to the Medicare website and do some research on that and see if that would get that. Most likely, if it's an employer-based plan, it's going to be credible. I have yet to hear someone who's had an employer plan that was not credible. Doesn't mean they're not out there. I mean, they could very well be, but I haven't run into it. If it's an employer-based, if it's, you know, a different kind of healthcare plan, I'm sorry, a drug plan that you picked up someplace else, you know, you'd want to have that verified by that company. And or Medicare might be able to help you out with that, because I'm sure they would have it listed if it's a credible company. Good question. And you do want to determine that if it is credible or not, because you know, if a person is age 65 and eligible for Part D and didn't take that out, you know, those penalties start, the clock starts. Good question.
Okay, thanks, Jim.
Okay. We've talked about Part A and Part B, which the government provides, and Part D for hospital, office visit, and for prescription drug plans. And we also then talked about Medicare Part C, which is the Medicare Advantage plan. Now I want to say a little bit about the Medicare supplement plans. I see, did a question come in there, Melissa?
Yeah, can we pause and answer this question? Because
Sure,
it has
absolutely.
to do with what you just talked about.
Okay.
Chuck is asking, does Everence offer an Advantage policy? And if not, why?
Okay, good
Medicare
question.
Advantage policy.
Yeah, good question, Chuck. The answer to that is no, we do not. And primarily, we had offered it initially when Medicare first came out, Medicare Advantage program. We did offer that. And as we evaluated that and its value to our members and their experience with it, we decided that that was not something that we wanted to continue. So Medicare Advantage, we dropped that fairly soon into the program after we worked with it. Medicare Supplement, we do continue to offer those plans, and it's one of our strongest resources that we're able to provide for our members when it comes to healthcare needs. But we dropped it because it was not meeting the needs. It caused a lot of confusion, a lot of paperwork. When you have to keep track of in-network, out-of-network, you got to keep track of your copays and your deductibles for out-of-pocket expenses, and then, you know, up to $6,700. That doesn't you know, make members happy. It's a lot of time. And so as we evaluated that, after we'd had it initially, then when Medicare started, we decided it was not a plan we wanted to continue, and so we did drop it. Good question. Thank you for that question. Melissa, was there a follow-up on any of that?
No, not at this time.
Okay, good. All right. Well, we'll move on then. We now are at the Medicare supplement plans, also affectionately known as Medigap. Perhaps you've heard that. And basically what it's referring to is supplementing or filling the gaps that Medicare offers. And we've talked about some of those deductibles, those co-pays and limited coverages and so forth that's offered there. So Medicare supplements, number one, they are from private insurance companies, just like other plans are. It's where the government and the insurance company have contracted together to provide the coverage. However, Medicare supplements complement Medicare. You don't leave the original Medicare plan, but we work together. A supplement plan and Medicare supplements and Medicare itself work together. They complement each other. You're not exclusive. Also, all the plans that are offered by any private insurance company that carries those have been these plans A through N that the government developed initially. Some of the plans have been dropped. You'll see some of the letters are missing there. In the next few years, there'll be more of them missing eventually, I believe, and some others may be added. Sometimes they have different plans from each of those that they adjust to, but each of the plans are standardized and developed by Medicare themselves, by the federal government. They're not developed by the insurance company and tinkered with at all. They're always going to be the same. So like a plan F at Everence and a plan F at another company are going to be exactly the same. The differences are going to be the service that you get, the cost that you pay per month, and the quality of that relationship that you can have with those companies. And then something else. Don't confuse parts with plans. So you see this alphabet issue is still here because all the government plans are letters A, B, C, D. Sound familiar? And that can be very confusing. You got parts A, B, C, and D, and you got plans A, B, C, and D, and it's easy to get confused. So you just want to remember parts deal with the federal government with their parts A. Plans come from a private insurer. And so that's a simple way to say it, but parts with the government, plans with the insurance company on that. Now, let me say just a little bit about how these Medicare supplement plans work. They are going to cover those deductibles or fill the gap, we might say, or supplement would be another way to say it, those costs that parts A and B don't cover. For example, their deductibles and their co-pays that you would have if you're go to the hospital, that $1,288 this year, I'm going to guess $1,300 or more next year. The supplemental plans pick up on those costs. Then there would be some co-pays that you may have when it comes to some of those extended care situations. The Medicare supplement plans are going to pick up on those, depending on what plan you get. That's why it says plans may cover. Part B, same thing. The deductibles and any of it's not going to cover the premium because that's going to be, something that you and the government work out. But when it comes to the deductibles, that $204 in 2017, that can be one of the coverages, and excess charges. That kind of blows some people away that there can be some excess charges. And this is the way those excess charges work under Part B. You go to a doctor and the doctor says, you need to have this diagnostic test. And so they give you a script and you go to the testing place. And they say, you ask, do you take Medicare for your diagnostic test? And they may say yes to that, then there's no problem. If they say, well, no, we don't take Medicare payment on that. We'll take what they pay, but we also have an excess charge. Well, they've contracted with Medicare to be able to do that. And so let's say the diagnostic test is, I'll say $10,000, okay? You go in there for that test, and that's gonna read it, and it's gonna have someone do the testing. The doctor says, I can't do it for $10,000, which is what Medicare pays in this case, we'll say, for example. Well, then the doctor says, well, I've had to buy extra equipment, I've had to hire new staff, I had to build onto the building, and you can just imagine. And so Medicare says, okay, you can charge up to 15% over what we pay. They pay $10,000. And so they can go another 15%, $1,100, $150 they can charge to that. And so the excess charge in, depending on what plan you would get under supplement, would pick up on those costs and cover it. Some of the plans, you assume that cost, but that's some of the cost that Part B can cover. So Part A picks up deductibles, copays, Part B, deductibles, and even the excess charges. And then also, you can do that supplement. You can get some of those emergency health care outside the USA, help supplement some of those costs in those emergency ways that Medicare doesn't cover. Again, it's very limited. It's not something that, you want to go and spend 6 months in the Riviera and have to go to the hospital, be in the hospital for 3 months. It's not designed for that, but for those emergency incidental needs, it's a great supplement for that. Okay, now how do you learn about Medicare.gov is that resource that I recommend. This is where you can get the information from there. And there's a great resource when you start to turn 64, 65 years old, you're going to get one of these Medicare and You in the mail. And the website, you can see a copy of the web page there. A lot of resources on there that you can go to and get some of the technical questions. And for example, sometimes people say, well, what are some of the treatments that are covered under Medicare? Well, there's volumes of them, there's thousands of them. Well, they got it all on there. You can actually look and see if your drug's covered or if your medical procedure is covered and so forth. You can actually get that kind of information on there. Or another way is give Everence a call. We're glad to help you out. There's a number that you can call. I work with a team of great people here in Goshen where you call and you have a question about Medicare, about any of the needs, and my team, call center here, we'll be glad to help you out with that. Okay, well, we've looked at Parts A, B, C, and D. We've talked about Medicare supplement. We've talked about some of your out-of-pocket expenses and costs that you may have. What questions do you have that you can send to Melissa? You can either type it in or she could probably even unmute you if you want to ask a verbal question.
Yep, I'm here waiting for questions. Anything that you need more explanation on? I don't see anything at this time. I'll wait.
Well, one thing too, I want to encourage you as maybe some of you are formulating your question, feel free to jot this telephone number down here and the extension 2463, and that'll ring directly into our call center here, and either myself or some of the other people that are in the team here will be glad to pick up and answer your questions and help you with any of your needs that you would have. When I think about Medicare, it's just a great resource that's out there for persons that are turning 65 or for those persons with a disability, and picking up on some of those supplement costs can be pretty valuable for you. I see a question may have come in. Maybe not.
No.
Okay.
No questions. Yeah, I think, well, this time we won't keep you online much longer, but we really thank you for taking time this afternoon to participate and for all the great questions that were posed to Jim. Yeah, and feel free to call him at that number if you have any further questions. So on my part, thank you very much.
Okay.
Do you have any last words?
Nope. Just appreciate the opportunity that Everence has to help you out, and feel free to give us a call whenever you have any needs.
All right. Well, thank you and enjoy the rest of your afternoon. Goodbye.
Goodbye.